I want to talk about anger. I want to talk about the expression of anger and anger management. And so I'm going to start by saying that the extent to which an individual becomes angry and how they express that anger is largely genetic. It's called the temperament, and you're born with it. And I fall on the side of nature when it comes to the nature versus nurture argument. And I'm not denying that certainly if you're raised in a household where there's a lot of expressed anger and even maybe violent behavior, that's not going to affect you. But I disagree with the idea that people who are exposed to that kind of environment learn to be angry people. Anger is an emotion. It comes from a very primitive part of the brain, the limbic system, and some people just get more angry than others. Some people are uncomfortable with anger, anxious types, people that are avoidant, that are shy. They're not comfortable expressing anger a lot of times. Those are the people that won't even send their food back if it's cold because they don't want to cause a fuss. Those people don't rage. The people that rage are people, they're good people. It's not that they were raised poorly or that they went through a lot of abuse. That might be true, and that might exacerbate whatever personality disorder they might have or whatever psychological problem they might have because they were exposed to that. But it's in the genes. It's the temperament. And just think about it. You can think about yourself. Are you somebody that gets mad easily or not? Does it take a lot to get you mad? Or do you get mad very quickly? And when you do get mad, how mad do you get? How often do you fume? How often are you furious? There are people that get furious all the time, whether it's traffic or road rage, or whether it's at work or at home with the family. And some people, there are people that have an anger management problem. It's a disorder because they get mad so intensely and so quickly and so easily and so often. And there's treatment for that, and those people really should take medication. I would never discourage anyone from pursuing therapy, cognitive behavioral therapy. Dialectical behavioral therapy is actually one of my favorites, and it deals with frustration tolerance and the regulation of emotions and interpersonal conflict. But the fact is that those individuals who have trouble with their anger, and this is assuming that they're not abusing drugs and that there are other variables that are causing the anger, because there are medications that can cause it. Stimulants are notorious for making people irritable and making them angry all the time. But if you are somebody who gets angry quickly and you shout, you yell, you scream when you get angry, you get so angry. I had one patient who told me that she got so mad at her husband. She was so mad at him that she had to punch him. She had to push him and hit him. The anger was so intense that it translated into violent behavior. And this was not a woman who condoned violence, but there were moments when she was just so furious that she had to hit him. And there are plenty of people that slam doors and throw objects, and it's because they're raging. They're on fire. Their brain is on fire. And so let's talk about anger and how it comes upon you. Emotions happen. They're triggered by environmental things, surely, but again, it's 90% internal. It is your temperament and any chemical factors that may come into play, and it's not just genetic. Think of irritability. That's a good example, because when you're irritable, you're getting mad at things that ordinarily wouldn't even make you mad. And then the things that would make you mad and would frustrate you are really frustrating you. They threaten to ruin your day, you're clenching your teeth, and sometimes you're acting out. You're rude to your loved ones, or whatever it is, you're honking the horn. Because when you're irritable, your threshold, your frustration tolerance is impaired. And so things are getting to you. And it's a physical sensation. You feel it. You're not choosing to be irritable that day. You just are. Maybe it's because you didn't get enough sleep. Maybe it's because you're hypoglycemic. You have a headache. Maybe it's because you're a woman and you're in the late luteal phase of your cycle. It's a change. And if you compare that state with your normal state, then you can understand a little bit. You have a glimpse of how important the chemical environment is in the central nervous system. And that is dictated by genes. And so assuming that there's no irritability and you're at your baseline, not everybody has the same baseline. It's just like worrying and anxiety. Some people are fraught with anxiety. They worry all the time, they catastrophize, they're always thinking about the worst case scenario, they're prone to panic attacks, and other people aren't. And it's genetic. So just as anxiety and major depression and other feeling states that are extreme are hereditary, so too is a person's temperament. And so many people, myself included, have this ability to get angry very quickly. And when you get angry fast, if you're somebody who can get angry quickly and intensely, just from day-to-day things, that you can rationalize all day long you were justified in being angry. But the point is that even somebody who's more timid, who's more meek than you are, that also would have gotten angry at that, would not have gotten as angry, and they wouldn't have behaved in the same manner. And then there are people that are so meek that they wouldn't even get angry at all. That's just, it wouldn't occur to them. And then you can go even further than that. People that are afraid to express anger, they don't like conflict and they don't like confrontation, and it just makes them very uncomfortable. When you feel an emotion, and you don't choose your emotions, you choose what you do with that emotion. You choose maybe to try to calm down and to not act out, but you don't choose the emotion. The emotion happens and it leads to thoughts. And sometimes those thoughts, if they're full of indignation, will fuel the anger. And anger is like fire. It's self-perpetuating. You can be so angry that you don't want to not be angry. Have you ever had that experience where you're mad and you're not done being mad? And it's like the anger doesn't want to go away. It's anger and anxiety are two emotions that they don't want to be treated. They are very stubborn and they're sneaky. But anger punishes the person who's experiencing it most of the time, unless you're acting out and victimizing somebody else and committing some sort of violence, whether it's physical or emotional. You're the one who's suffering. You're the one who's on fire. It's like being blindsided. I know that in situations in which I've lost my temper and I've raised my voice and I've acted out in a way that later I regretted, and then I tell myself, I'm not going to do that again. Don't do that again. Don't behave that way. It's not that big a deal. You shouldn't have done that. And then it happens again. How is that? And then again. And I'm a psychiatrist. I struggled with it for years. And what happens is you are blindsided by the anger. You go from 0 to 60. One minute you're fine, and then maybe you're slightly annoyed, and then the next thing you know, you are raging. And it's too late to not get that angry because you didn't see it coming. And it just hits you like a ton of bricks, like a bus, you know. And so what medicine does, serotonergic medicine in particular, you raise serotonin, and what that does is it changes that physical threshold that changes when a person becomes irritable. But instead of going down, it goes up. So it takes more to upset you. And things that are bothersome and a nuisance, you can just kind of, oh well, you know, bad luck. And it's like water off a duck's back. The little things. And then the bigger things are just not as infuriating. And so you can still get mad, but then if you're also being mindful and if you're also applying those dialectical behavioral techniques and you can see the anger coming, it builds, you start to simmer, and then you get more frustrated. And then you have time to say, okay, here I go, and I'm not going to go there. I'm not going to raise my voice. I'm not going to yell at this customer service person on the other end of the phone who's just trying to do their job. And, you know, maybe they're a little slow, but it's really not their fault that the phone company charged me twice or whatever it is. How many times do we take it out on the person that is just trying to serve? But the people that really rant, it's because they're experiencing a symptom. And so to learn how to handle it, you can certainly do it without medication, but it's much harder, and you're probably going to fail sometimes if you truly have severe anger management problems. Your lip might quiver with rage, and your blood pressure's up and your heart rate is up. These are vegetative functions. You don't choose to elevate your heart rate. You can't. And yet those parameters are increased because the adrenal glands are releasing adrenaline and you are in fight mode. Some people are just programmed that way, and if it's a real problem, then you definitely avoid the things that exacerbate it. Try to have a healthy lifestyle, get plenty of sleep, stay away from stimulants, and if you need therapy, go to therapy. But if all of that is still not working, then a low dose of an SSRI will work like that overnight. Overnight. You don't have to wait weeks and weeks. It's the first symptom that gets better when we increase serotonin is irritability, or simply the threshold for anger. That lowers immediately, and people notice it right away. Even people that don't have problems with anger. They notice just going about their day that they're just not frustrated by the little things. So the SSRIs, when they're used to treat that emotion, are like emotional analgesics. It's like when you stub your toe and the pain is intense and you can't do anything but wince and moan and groan for a few seconds until that pain is gone. That's all you can do. Just stand there silently and take it. But for a few seconds, you're immobilized, right? Well, if you were on morphine, let's say, and you stub that toe, it might still hurt, but it's not going to be nearly as intense. And you're going to be able to recover from it much more quickly. And so this is analogous to that. Serotonin is an emotional analgesic, not just for anger, but also for anxiety.